Okay, so it's recording now, okay?
Yeah.
Perfect. Okay, hi John, how are you today?
Good, thanks.
Good. So obviously I'm Kirsty and I'll be your trainer. So today we're going to go through your pre-exercise screening results, your fitness assessments, doctor's recommendations, exercise goals, and we'll also complete just a short risk assessment of your exercise space that you have there. And this will obviously help me design a safe and effective program for you. Is that all okay?
Yeah.
Yeah, perfect. So first, I'd just like to go through your pre-exercise screening form. So you did indicate that you have a medical condition, hypertension, which obviously means you need a medical clearance before beginning exercise. You did provide your doctor's clearance, and they did also give some guidelines for us to follow, which is great. Other than that, you didn't report any chest pain, dizziness, asthma or diabetes or any recent injuries. So because we've got that clearance, it is safe for us to proceed with moderate exercise. Does that all sound correct to you and there's been no other changes in your medical history?
Yeah, that sounds good.
Yeah, perfect. So let's review your fitness results. So your blood pressure was reading 145/91, which is high, but obviously consistent with the fact that you do have hypertension. And your BMI and weight measurements do place you in a bit of a higher risk category for cardiovascular disease. So we do want to try and lower them if possible. And based on your BEEP score test, it is sitting at a poorer level just for your age group. And your strength and endurance scores are also a little bit below average as well. So we'd like to work on that alongside your flexibility as well. So main thing is that we want to improve your obviously cardiovascular fitness, your strength, flexibility, and hopefully then that will improve your overall health. Do you have any questions about any of those results?
No, that's all sounds
No.
fine.
Yeah, perfect. We can get working on those ones. So your doctor has given us some clear guidelines. So you're approved for moderate to intense aerobic training and moderate resistance training to help you lose about 5 kilograms and improve your heart health. There are some safety rules that we have to follow though with having the hypertension. So no lifting above your heart line, no isometric holds, no holding your breath. That's just to avoid spiking your blood pressure levels. And all exercise must stay at a moderate intensity level. So if any time when you're doing the exercise and you feel like you are getting really breathless, it's not really that high rate, we do need to back off on that. Okay.
Okay.
Perfect. So now I'll explain how the screening and the medical info will affect the programming. So based on your health background and your fitness levels and also your doctor's advice, your program's going to focus mainly on walking and cycling and other similar like moderate aerobic exercises. So we're not going to send you out on a big run basically. Moderate resistance training with some controlled movements. There won't be any real heavy lifting and no isometric exercises, like I mentioned earlier. And there'll be lots of technique monitoring, longer warm-ups and gradual progression, just so we're staying in that moderate level and not, again, spiking the heart rate. And this should help you improve your cardiovascular fitness safely while managing your hypertension. Does that all sound doable in
That
line?
sounds absolutely fine.
Perfect. So just so I can design the program best for you, I just want to understand more about your personal motivations. So what are your main reasons that you wanted to begin an exercise program now?
I want to get fitter, lose
Yeah.
weight.
Perfect. Also to help with that hypertension, so it's
Yeah.
try and reduce that one. And how important is it, sorry, for you to make these changes right now on a scale of 1 to 10, where 1 being not interested at all and 10 being most important?
I'd say 8.
8, perfect. And what do you feel like the biggest benefits for you if you stick to the program? Like, what do you want to see?
Well, better fitness and longer life.
Perfect. Yeah, great. So that's really helpful. Can I ask about your current fitness exercise routine? What types of physical activity you're doing at the moment?
Don't really do much, little bit of walking.
Yeah, a little bit of walking. Okay, great. We can start with that one. And in the past, have you had any exercise experiences, like positive or negative, that I should be aware of?
I don't tend to like gyms because I don't really understand the machines properly or stuff
Okay,
like
great. We can do some work on that as well. Perfect. So, minus all that, are there any challenges or barriers that might make it difficult for you to exercise regularly? For example, your medical conditions or energy levels, mobility, work schedule?
on medical conditions now.
Okay, perfect. So I just want to ask you a few questions now about your exercise space so I can design a program that actually fits what equipment and the space that you have. So where do you plan on doing the workouts at home? What area have you got?
So if it's, I've got a garage, I'm stood
Okay.
in the garage now.
Yeah.
So
And is that where your fit? I can see some a rack in the back there. Is that where all your fitness equipment is and you feel comfortable training?
yes,
Yeah, perfect. Can you just show me around the space a little bit, just moving the camera around? Oh yeah,
that's
so you've got a squat rack there. Oh, and I can see some resistance bands.
some
Some dumbbells. We've
weights.
got a good range there. And a treadmill, perfect. Um, and quite a big area on the floor. Is there enough space there? Yeah,
Yeah, it's fine there. Plenty of
awesome.
space.
Okay. Well, let's complete a risk assessment together as a look at your space for any hazards. How slippy is the floor? Is it quite hard? Is it slippy or is
It's
it?
concrete floor, but it's not slippy. It's not
Okay.
really slippy.
So quite hard. Do you have a mat that we can use when you're doing your exercises just for that impact?
Yes, I
Yeah,
shouldn't be
awesome. And there's enough room that you can move around. Like I wouldn't be getting you to do burpees, but if you were up and down
Oh
and
yeah,
back and
plenty,
forth, there's
plenty
enough room,
to.
no tripping hazards. The light, is it bright enough or is it a little bit dimmer with it? I can know it's
Probably
night time.
slightly dim, but not too
Okay,
much.
so we'll just concentrate on lighting. Maybe the different, is it lighter during like mornings and afternoons with the sunshine?
If I could open the garage door,
Oh, perfect.
some more lighting.
And all of your equipment, it looks pretty new, but is it all in good condition or is there anything I need to be aware of that
All pretty good condition,
needs?
yeah.
Yep, awesome. Okay, so based on what I can see, we'll just make sure that obviously I know it's a garage, so if you do bring the lawnmower in or something, just making sure before a workout that you do have a really nice clear space, you're not tripping over a hammer or anything. We'll definitely get that mat put down just for non-slip. Make sure the lighting's good. Like I said, if you can open that garage door so the lighting's perfect. And then always just check your equipment before use. So if you are doing any barbell lifts or pushes, just making sure you are using the clips. I can see some in the background there. And if anything's looking like it's not suitable, just let me know. We can swap it out of the program.
Okay.
Yes. And also, obviously, always make sure you have some water available, especially in the garage if it's getting hot during summer. So yeah, does that all sound okay and doable?
Sounds fine.
Awesome. Well, thanks for that, John. That's, I think, all the information that I need to be able to design your fitness program. I'll complete the risk assessment and just a little form for you, and I'll begin working on your exercise plan. Do you have any questions before we finish up?
No, I'm absolutely fine with that.
Awesome, perfect. Well, have a lovely evening, and I will send that all over to you soon.
Okay, thanks.
Thank you. Bye.
Thanks.